Hello students, welcome back to Community Health Nursing. So today we are going to start with intestinal infections under the unit Epidemiology of Communicable Diseases. So in that respiratory infections we have finished. Today we are going to start with intestinal infections. So from today onwards the signs and symptoms, all the incubation period, everything we can, when we compare each of these diseases, we'll be able to identify there is a remarkable change. So let us see what all are the variations in intestinal infections. Today let us start with poliomyelitis. Maybe you all have heard this word, poliomyelitis. So what do you mean by poliomyelitis? So before entering into the epidemiological part, let us have a small introduction about this particular infection. Poliomyelitis is a crippling and potentially deadly infectious disease caused by poliovirus. So it is caused by poliovirus. That's what the name poliomyelitis. And it is a very potential deadly infection. That means even it can lead to death of a person. This starts as primary infection of the human alimentary tract. So in the starting stage, this infection starts as an intestinal infection. It affects the alimentary tract. This virus spread from person to person and it infect the brain and even the spinal cord, leading to paralysis. That's what it is, especially we are telling it's a deadly infection. So don't think that it will be just infecting the intestinal system. So it will spread from person to person very fast, especially it will affect the brain and the spinal cord, leading to even paralysis of the person. So since we have started so many initiatives from 1988 onwards as a part of global polio eradication, we can see a sudden down in the incidence of poliomyelitis, that is even a down of 99%. So from 1988 onwards, many initiatives has been started globally in order to eradicate the polio. If we look into the data, the World Health data reveals that there were around this much of children paralyzed or killed annually in 125 endemic countries in the year 1988. There is no need for you to study the statistics. I just shown this because you will get the intensity of the particular disease. So around 125 countries were really affected, and it was an endemic spread we can see. And the data of 2011 really shows that there were 620 cases reported in 16 countries. So see, from 1988 again, when the time of 2011, again we were able to report the cases even in 16 countries. ഇല്ലേ, 1988 125 രാജ്യങ്ങളിലുണ്ടായിരുന്നുവെങ്കിൽ ഗ്ലോബൽ ഇനീഷ്യേറ്റീവ് ഒക്കെ കാരണം അത് കുറഞ്ഞ് 2011 ആയപ്പോഴേക്കും, ബട്ട് സ്റ്റിൽ there were a presence of polio in around 16 countries, around 620 cases also. In 2006, India was one among the 4 polio endemic countries. So in 2006, India has also become one among the countries which is affected with polio. Then because of the extraordinary progress in the campaign or in the work of the polio against polio, India has reported only one case in 2011. So by 2011, on January 13th, we were having only just one case. So there was an exemplary performance compared to 42 polio cases in 2010 and 741 cases in 2009. So see, we can see a remarkable reduction. Then by 2011, so 2009 നമുക്ക് 741 കേസ് ഉണ്ടായിരുന്നുവെങ്കിൽ 2010 ആയപ്പോഴേക്കും വെറും 42 പോളിയോ കേസാണ് ഇന്ത്യ റിപ്പോർട്ട് ചെയ്തുള്ളൂ. പിന്നീട് 2011 ആയപ്പോഴേക്കും we had only just one polio case. So this is just about the incidence rate of poliomyelitis in our country. So let us see about the causative agent. So from here we have to mainly focus upon. So we have seen poliomyelitis is a potential deadly infection which really affect the alimentary tract, and later it will spread from person to person, and it will affect the brain and the spinal cord, even leading to paralysis. These much things you should remember in the introductory part. So let us see what is the causative agent and what are the features of the causative agent. So poliomyelitis is an acute viral infection caused by poliovirus. Even though it has three serotypes. It has especially three serotypes: serotype 1, serotype 2, and serotype 3. But the most outbreaks occur due to the type 1 virus. So it is caused by poliovirus, and mainly it is affected by the poliovirus type 1. Man is the only known reservoir of infection. Only it will affect the man. He is the only reservoir of the infection. The poliovirus can be inactivated by autoclaving and different physical and chemical methods. So this poliovirus we can inactivate by doing autoclaving, or like I hope you all know what is autoclaving, the sterilization method which you have studied in microbiology, and by various physical and chemical methods by using the physical agents and even the chemical compositions also. These all can really make the poliovirus inactivated. The virus is found in the feces and oropharyngeal secretion of an infected person. So if a person is infected, the feces of that particular person and the oropharyngeal secretions, so these two things can be have the presence of the virus, the stool and the oropharyngeal secretion. The cases are most infectious from 7 to 10 days before and after the onset of symptoms. So the cases will be more infectious. They will be able to spread the infection from one person to another person during the 7th to 10th days before and after the onset of symptoms. So when we look into the host factors, we can see that all age groups can be affected, even though the children are more susceptible than the adult. So it is mostly focusing upon the children. Then polio incidence varies between the gender factors. Like if we look into the ratio, we can see that 3 males and 1 female is the ratio how it affects. So we can tell that it has a gender difference. It affects especially males than females. The risk factors found to provoke the disease in individuals already infected with the virus. So if a person is already infected with the virus, the risk factors can really provoke the disease in an individual. That means there is a chance of recurrence in the presence of risk factors. അതിനു വേണ്ടിയിട്ടുള്ള റിസ്ക് ഫാക്ടേഴ്സ് ഉണ്ട് എങ്കിൽ ആ ആൾ പിന്നെയും എക്സ്പോസ് ആവുന്നുണ്ട് ഇൻഫെക്റ്റഡ് പേഴ്സണുമായിട്ട് എങ്കിൽ വീണ്ടും ആ ആളിൽ ഈ ഡിസീസ് പ്രൊവോക്ക് ചെയ്യാനുള്ള സാധ്യത ഉണ്ട്. Maternal immunity, if one baby has received from the mother, means it will last only for 6 months of life. അമ്മയിൽ നിന്നും കുഞ്ഞിന് ആ പ്രതിരോധശേഷി ജന്മനാ കിട്ടിയിട്ടുണ്ട് എങ്കിൽ പോലും അത് ജീവിതത്തിൻ്റെ ആദ്യത്തെ 6 മാസം മാത്രമേ നിലനിൽക്കുകയുള്ളൂ. സോ ആഫ്റ്റർ ദ 6 months they will lose the immunity, and again the child may have a chance to get polio. When we look into the environmental factors, we can see that most often it occurs during the rainy season. Especially during the rainy season it is mostly occurred. Then the sources of infection are contaminated water, food and flies. That's what we were telling about the risk factors. If a person is living who is living where there is a contamination of this virus with food, water and flies, then of course the person have a chance to get. Poliovirus survives for a long time in a cold environment. So especially most of the virus, we all know that during the cold season they can survive for long time. So here also the poliovirus also can survive for a long time in a cold environment. The overcrowding and poor sanitation facilitate the infection. So the two main risk factors are overcrowding, poor sanitation and cold climate, especially the rainy season, and contaminated water, food and flies. So these are the various environmental factors. So what all was the epidemiological triad of the poliomyelitis? Agent is poliovirus, host all the age groups, but especially children are more susceptible. Then it shows a sex difference or the gender difference, like males are more infected than female. Then when we look into the environmental factors, we can see that rainy season and contaminated water, food and flies, and a cold climate, and even overcrowding and poor sanitation. These are the environmental factors. This is all about the epidemiological triad of poliomyelitis. Now let us see how it how it is transmitted, the transmission. So the transmission occurs especially of two types. One is fecal oral route. So the main route of spread of infection is fecal oral route, directly through contaminated fingers or indirectly through the contaminated water, milk or other food or flies and articles of daily use. So it can be spread through the fecal oral route directly through contaminated fingers, if the fingers are contaminated with the feces, and if we eat with that same fingers without hand washing, and indirectly it can be get contaminated towards the water, milk, all this thing. So this is one route, fecal oral route. The next one is droplet infection. So the close personal contact during the acute phase of the disease facilitates transmission through droplet infection also. So during the acute phase, so during the strong phase, if the person is having a close contact with the person, then there is a chance of transmission even through the droplet also. When we look into the incubation period, we can see that 7 to 14 days is the incubation period, but it may ranges from 3 to 35 days also, because there are cases which shows even 3 to even 35 days ranges also. That's why we always should take care of this type of communicable disease, because there is no particular deadline. നമുക്കൊരു കാര്യത്തിൽ ഒരു ഉറപ്പ് പറയാൻ പറ്റില്ല. Even though incubation period is ranging normally from 7 to 14 days, we can see there is a range of 3 to even 35 days of incubation period also. When we look into the symptoms, the various symptoms occurs due to poliomyelitis is, first one is sore throat, then the person may have fever, tiredness, anorexia, nausea and vomiting, headache, abdominal pain, constipation, stiffness of the neck and the mag muscles. So it may cause the difficulty in swallowing, and there may be weakness or diminished tendon reflexes before the onset of paralysis. I hope you all know what is the word meaning of tendon. What is tendon? Yes, it is a strong elastic muscle which connects the muscle with the ബോൺസ് അല്ലേ, മസിൽസിനെ ബോൺസുമായി യോജിപ്പിക്കുന്ന കണക്റ്റീവ് ടിഷ്യൂ അല്ലെ ഒരു ഹാർട്ട് ടിഷ്യൂ ആണ് ടെൻഡൻ. സോ ദ ടെൻഡൻ റിഫ്ലെക്സസ് വിൽ ബി വീക്കൻഡ് അല്ലെങ്കിൽ ഡിമിനിഷ്ഡ് ബിഫോർ ദ ഓൺസെറ്റ് ഓഫ്, നേരിട്ട് പാരാലിസിസിലോട്ട് പോവുകയല്ല പേഷ്യൻ്റ്, ആദ്യം തന്നെ ടെൻഡൻ റിഫ്ലെക്സസ് എല്ലാം വളരെ വീക്കാവും. ദ പേഷ്യൻ്റ് വിൽ നോട്ട് ബി ഏബിൾ ടു ഹാവ് എ സ്മൂത്ത് മൂവ്മെൻറ്റ്, and the paralysis starts at the hip and descending to the distal parts. So in the hip usually the paralysis starts and it descend to the distal parts. ഹിപ്പിൽ നിന്നും തുടങ്ങി താഴെ കാലുകളിലോട്ടാണ് കൂടുതലും ഇതിൻ്റെ പാരാലിസിസ് അഫക്റ്റ് ചെയ്യുന്നത്. Then there may be weakness or loss of voice of the person. Then death can occur due to respiratory insufficiency. So since it affect the tendon, so even sometimes there may be respiratory insufficiency also, because of the stiffness of the neck, back muscles, all these things. It can even lead to the death of a particular person also. So that's why we call it as a deadly infection. Then when we look into the preventive measures, we can see immunization is the only prevention. So in that we have two types of vaccines present for this poliomyelitis, that is IPV and OPV. What is IPV? Inactivated polio vaccine, IPV. And next one is OPV, that is oral polio vaccine. We all are more familiar with this oral polio vaccine. So first let us see what is IPV. So at least you have to remember these two things. Just I am going to give you little more information about IPV and OPV. So Dr. Jonas Salk introduced IPV in 1955, and it is also called the Salk vaccine. You have to remember this particular word. IPV is otherwise known as Salk vaccine. IPV has all three strains of inactivated poliovirus types. It is administered by intramuscular injection, IM injection, and it requires a trained health personnel to administer the vaccine. So the vaccine is injectable, so it is administered IM injection, and a trained person is needed. So always remember it is IM injectable, IPV. It is not injectable polio vaccine എന്നല്ല പക്ഷേ നമ്മൾ പറയേണ്ടത് ഇൻആക്ടിവേറ്റഡ് പോളിയോ വാക്സിൻ. ഓർത്തിരിക്കാനായിട്ട് നിങ്ങൾക്ക് ഇൻജെക്റ്റബിൾ പോളിയോ വാക്സിൻ എന്ന് ഓർത്തിരിക്കാം, ബിക്കോസ് ഇറ്റ് ഈസ് ഗിവൺ ത്രൂ ഇൻജെക്ഷൻ, IM injections. So since it is introduced by Dr. Jonas Salk, it is known as Salk vaccine also. IPV is also known as Salk vaccine. So the advantages are IPV does not have a risk of vaccine associated polio paralysis since it is not a live vaccine. Since it is not a live vaccine, this injection will never cause any paralysis. Second is IPV develops an exceptional protective immune response in most people. In most of the people, it is very really effective since it boosts up the immunity very strongly. These are the advantages of IPV. There are few disadvantages also. So some of the disadvantages of IPV is IPV induces very low level of immunity in the intestine. As a result, when a person immunized with IPV is infected with wild poliovirus, the virus can still multiply inside the intestine and be shed in the feces and risking the continued circulation. So there can be chance of a person because it shows very low immunity towards the intestine. So the person can again, those who have even got the immunization with IPV can get infected with a wild polio virus also. So you just remember IPV gives very low immunity in the intestine. IPV is very costly. The second point is IPV is very costly. This cost around 5 times more than the oral polio vaccine. Oral polio vaccine നമ്മൾ ഫ്രീ ആയിട്ട് ഗവൺമെൻറ് പ്രൊവൈഡ് ചെയ്യുന്ന ഒന്നാണ്. ബട്ട് IPV it is an injectable one and it is very very costly compared to oral polio vaccine. The next disadvantage is administering the vaccine requires, since it is injectable, of course it need a well trained health personnel and we need a sterilization technique, and a strict sterilization technique should be followed throughout the procedure. But in case of OPV, there is of no that much of risk of the sterilization because it is administered orally. Here it is injectable, so we have to take care of all the sterile precautions and we need a well trained health personnel. These are some of the disadvantages of IPV. So let us see about OPV, oral polio vaccine. It is developed by Albert Sabin. So of course the other name is Sabin vaccine. The other one was Salk vaccine. This is known as Sabin. So always remember, Sabin means oral polio vaccine, Sabin vaccine. So it is also known as Sabin vaccine, otherwise trivalent oral polio vaccine also. So it has a mixture of live and attenuated polio virus strains of all the 3 polio virus types. And OPV tends to produce antibodies in the blood of all these types of poliovirus. All the 3 types are there in both of these IPV and OPV, but in case of IPV it will never cause any paralysis, but here it is a mixture of live and attenuated. That means the weakened strains we are going to give orally. So when a child we can see when a child contact infection, these antibodies protect against paralysis by preventing the transmission of polio virus to the nervous system. So in this, the antibodies will really protect against the paralysis because it prevent the transmission towards the nervous system. So the OPV, oral polio vaccine, triggers the local mucosal immune response in the mucous membrane of the intestine. So it is very much effective towards the intestine, and this intestinal immune response of OPV is considered to be the major reason why it is used as a mass campaign. That's why worldwide or in India or all over we are providing OPV, oral polio vaccine, because it is very much strong against the intestinal part or the intestinal immune system. So we always prefer OPV, and person to person transmission also can be quickly stopped by the OPV vaccination. So let us see some of the advantages of OPV. So OPV is administered orally. It does not need any training or sterile equipment, as I have told. Only just by showing how to give, a person can give the oral polio vaccine. That's why even the student nurses are also a part of polio vaccine during the particular campaign time. So if you ask your seniors, many of your seniors also have been a part of the oral polio vaccination, because there is no need of much training or sterile equipment needed for providing it orally. This vaccine is comparatively inexpensive. When we compare to IPV, OPV is very cheap, and OPV is safe and it is effective, and it brings long lasting immunity to all the three types of polio virus. For all the three strains, the strains 1, 2 and 3, everything, it will give a long lasting immunity it provides. After few weeks of vaccination, the vaccine virus replicates in the intestine. This gets excreted in the feces and transmitted to others who are in close contact. So whenever the hygiene and sanitation are poor, the immunization with oral polio vaccine can cause passive immunization of people through they are not directly immunized. So even though the people are not directly immunized also, sometimes it can even lead to passive immunization of the people, because once we provide vaccination, the vaccine virus replicates, it multiplies in the intestine, and this gets excreted in their feces. Through the stool it gets excreted and it transmitted to others who are in close contact. So of course even that people also will get immunized passively through that. So even we can tell it as a very good method. OPV can even provide passive immunization to other people also, those who are in close contact. But still there are some disadvantages. So the first one disadvantage is the live attenuated vaccine virus in oral polio vaccine may induce paralysis in very rare case. ഇതാണ് ഇതിൻ്റെ ഒരു മെയിൻ ഡിസഡ്വാൻറ്റേജ് എന്ന് പറയുന്നത്. നമ്മൾ ഓർക്കും ഇത്രയധികം നല്ല കാര്യങ്ങളുള്ളപ്പോൾ നമുക്ക് എന്തുകൊണ്ട് OPV തന്നെ എടുത്തുകൂടാ. ബട്ട് ദ തിങ് ഈസ് ഇൻ വെരി റെയർ കേസ്, ഇഫ് ദ പേഴ്സൺ സംടൈംസ് ഇഫ് ഇറ്റ് ഈസ് എ വെരി ലോ ഇമ്മ്യൂണിറ്റി പേഴ്സൺ ഒക്കെ ആണെങ്കിൽ, ഇതിൽ ലൈവ് അറ്റനുവേറ്റഡ് വാക്സിൻ ആണ് അല്ലേ, വീക്കൻഡ് വൈറസ് ഇതിലുണ്ട്. സോ സംടൈംസ് ഇറ്റ് മേ കോസ് പാരാലിസിസ് ഇൻ വെരി റെയർ കേസ്. ദ വൈറസ് in the vaccine may inherently change and start to flow even in the population also. So this is a small percentage of risk. That's why we have the other option, even IPV also. So this is all about the polio vaccine. Then we can see that the newly introduced, we have a newly introduced heat stabilized oral polio vaccine which can be stored at 4 degree Celsius for a year period without losing its potential. The potency will not be lost even though if we are storing it as a 4 degree, read it as 4 degrees Celsius for a period of at least one particular year. Non-stabilized oral polio vaccines, we have to store it as minus 20 degrees Celsius in a deep freezer. So non-stabilized oral polio vaccines are also there, but it has to be stored in minus 20 degree in a deep freezer. So these are some of the new technological aspect of oral polio vaccines. So now let us see, other than vaccine, what is the next option? The next option is human normal IG. So like this is a passive immunization. Almost this has been, so we are not at all using this. We have been eliminated from use due to active immunization with OPV. Since we have a OPV vaccination, actually it is nobody using, but still I am just telling you we have a passive immunization also which is known as human normal IG. That means we are providing the antibody here. This is given in a dose of 0.25 to 3 ml per kg body weight. So there is no need for you to remember, only you can remember IPV and OPV. You should be able to identify the advantages and disadvantages of IPV as well as OPV also, because sometimes in the competitive exams as the multiple choice they used to ask even the other name of IPV. What is the other name of IPV? Salk vaccine. Other name of OPV is Sabin vaccine. So now let us see the surveillance. So how we can do the surveillance? The surveillance can be done only through early diagnosis. So in the surveillance, the first one is acute flaccid paralysis surveillance. So the nationwide AFP, what is AFP? Acute flaccid paralysis. So this surveillance is considered the gold standard for detection of cases of poliomyelitis. So let us see how they detect. So the main 4 steps in how they detect, do this surveillance is, first one is identifying and reporting the children with acute flaccid paralysis and sending stool samples for analysis, and then isolating and finding out the polio virus in the laboratory. We have to isolate such type of children, and we have to find out whether there is any presence of polio virus in the laboratory laboratory will be doing the stool examinations and mapping the virus to find out the place of origin of the virus strain. Then we will be finding out how the child got it, how the child got this particular infection, from where it is started. This is about AFP. So don't get panic by hearing AFP. AFP means acute flaccid paralysis surveillance. We are going to do the surveillance. So this is an active surveillance, we can tell, because we identify the children and we report such type of children, and we send the stool samples of such type of children. Next, AFP reporting procedure. So like immediate reporting of AFP cases below 15 years of age and paralytic illness in susceptible age for polio attack. This should be investigated within 48 hours. So if we really get a positive case under 15 years of age and paralytic illness is suspected in that particular age of child, means then within 48 hours really they have to start the investigation. We have to collect 2 stool specimens 24 and 48 hours apart and within 40 days of the onset of paralysis. So if there is if the child has undergone any paralysis, after that immediately 48 hours to 24 to 48 hours in between, we have to take 2 stool samples and we have to see like within 14 days. This is what we tell it as AFP surveillance, acute flaccid paralysis surveillance. Then only we will be able to avoid the spread of this particular strain to others. Then when we tell about the environmental surveillance, we can tell that the testing of sewage and other environmental samples for the presence of poliovirus are the vital measures of environmental surveillance. Environmental surveillance in the ഭാഗമായിട്ട് നമ്മൾ എന്താണ് ചെയ്യേണ്ടത്? We have to take the samples from the sewage and other environmental samples, അല്ലേ? കെട്ടിക്കിടക്കുന്ന വെള്ളത്തിൽ നിന്ന് അല്ലെങ്കിൽ വേസ്റ്റിൽ നിന്നൊക്കെ നമ്മൾ ഇതിൻ്റെ സാമ്പിൾസ് എടുത്ത് നമുക്ക് we have to check the presence of polio virus. And generally the environmental surveillance most often help in identifying polio virus infections in the absence of cases of paralysis. Even though before attacking the people and causing paralysis, before ahead we'll be able to get the source of infection if we check like this type of environmental surveillance. The systematic environmental sampling which is mainly used in Egypt and even in Mumbai, like as we do in Mumbai, because Mumbai we all know that it is thickly populated there. So they do this environmental surveillance every time. Systematically they do this from the waste and from the water. They look for this type of strains. If there is any presence of this, suddenly they will take the action. So it is very good for avoiding or controlling the spreading to others. Then when we look into the pulse polio immunization program, because in India it has started its pulse polio immunization program in early of 1995 onwards. We have this pulse polio immunization. All the children in the age group of 0 to 5 years are administered polio drops under the national immunization rounds every year, and about 172 million of children are immunized during each national immunization day. So we know that how much all over the India, all the children those who are below 5 years, they get immunized. WHO on 24th February 2012 removed India from the list of countries with active endemic wild polio virus transmission. So we can tell that 24th February 2012 onwards, India is free from the list of countries under the WHO. That means we are free from the endemic wild polio virus transmission. So we don't have an active endemic wild polio virus transmission from 2012 onwards. So here in this table, you can clearly see that the oral polio vaccine schedule. Already you all have studied this, but still I thought it will fresh your mind if I show this. So at birth we give the zero dose. We give the 0 dose of polio vaccine. Then by 6 weeks the first dose is given, 10th week second dose is given, 14th week we give the third dose, and 16th to 24th month we give the booster dose. So the route is, as we all know, the name indicates oral polio vaccine, that is oral route 2 drops we used to give. This is about the oral polio vaccine schedule. Sometimes some funny things happen during the viva part. Sometimes the external examiner, they used to ask which is the route of OPV. So suddenly the children start telling intradermal, subcutaneous. So always remember, OPV is oral polio vaccine. The route is oral. It is given orally 2 drops. The other one is IPV, that is inactivated polio vaccine. IPV is given intradermally. Intramuscularly, it is given as a administered as IM, intramuscular injection, IPV, but OPV is always oral polio vaccine, that is of 2 drops. So with this I would like to complete this particular topic. So today we have studied about poliomyelitis. You all have to read this particular topic in KPARK. It is even given in KPARK textbook also, so that you will get much more information. So I have given the basic things, the important things, whatever you have to study under this particular topic, but still you all have to read this topic in KPARK also. Thank you, students.